please remove your presenting screen. Yes. Thank you, Rahul. Jitesh, how many people are joined?
So right now 39 people joined on the screen. So we are waiting for more. It's 5:58. So we are waiting 2 minutes more. Yeah.
Right. Narendra sir?
Yes, yes.
Narendra sir, Dr. Narendra sir? I am audible, Dr. Narendra?
Yes, sir, you are audible. Hello.
Dr. Narendra, when we start this YouTube live,
It is already start. We are on online YouTube online. No issue. Okay.
Okay.
Hello Rajiv. Hello. Hi Rajiv.
Hello, Sekar sir. Hello.
Hi.
Good evening.
Good evening. Good evening. Okay. All the way.
All well, sir. All well. Jitesh, our speaker and panelist join. All speakers and panelists.
So all the speakers are joined, and Trupti ma'am is there. Anish sir is there. Rahul, uh, Abhishek. So we are waiting for Abhishek. I think Abhishek. Abhishek is not. Mr. Abhishek.
I I think we have 1 minute more, right? Then we start on time.
वहाँ कट जाएगा अगर आप रोकेंगे तो कैसे हम लोग नहीं कनेक्ट कर सकते हैं ये सब ये तो लिंक कैसे समझाएंगे लिंक तो सबके पास चला गया
Okay. Jitesh?
Yes. Yes.
Now six time. We are start on time.
Yeah. So we have like 50 participants on a screen. So yeah,
Okay.
we can start.
Okay. Later the people are join later. That's not the issue, but we start on time.
Yeah.
Okay. Okay, everyone. Now, good evening, everyone, and welcome to today's webinar hosted by All India Association of Medical Social Work Professionals, Central Zone, on scope and challenges of social work profession. Before we go further, I welcome our association president, general secretary, all governing body members, association members, eminent speakers, panelists, dear colleagues, professionals, students, scholars, trainees, and participants from other countries. Now we proceed towards opening of webinar. I requested our association president, Mr. B.R. Shekhar, to deliver a welcome note. Before his note, I would like to introduce you all Mr. B.R. Shekhar. Mr. B.R. Shekhar is pass out from Delhi School of Social Work, Master in Social Work in 1990. Presently, he is working as a Chief Medical Social Service Officer in AIMS, New Delhi. He is also president of All India. He is also president of AIMS Medical Social Service Officer Association. He is having vast experience of 30 years in teaching, training, rehabilitation, and implementation of government program and policies. Sekhar sir, over to you. Sekhar sir, please proceed.
हो गया मैडम का हो गया.
Sekhar sir.
वो बोल रहा था तो इनकम उसका पड़ा था.
Sekhar sir, please proceed for the president.
Okay, Rajiv. Thank you, Rajiv. Thank you so much. Dear friends, good evening, everybody. This is the fourth webinar of series of AIAMSWP, that is All India Association of Medical Social Work Profession. So I would like to welcome all the guest speakers and participants of this event on the behalf of our national level association, All India Association of Medical Social Work Professions. I would like to welcome Dr. Anish KR. He is the assistant professor and former HOD of Department of Rajgiri College of Social Work, Kochi, Kerala. I also would like to welcome and thanks to Dr. Tulsi Bhardwaj. She is assistant professor at the BR Medical College, Delhi University. I also welcome my colleague who is working with me, Mr. Abhishek Rajput, MSSO in AIMS. I also congratulations and thanks to Rajiv Makri. He is the convener of this event. He is working with us, main Forward Department, New Delhi. I also would like to thanks and congratulate our moderator, Mr. Jitesh Pandey, of this event. I'm delighted. Yes, I'm delighted to have this opportunity, part of this webinar on scope of challenges of social work and the field privilege to share my view with our experienced analysts. I'm B.R. Shekhar, President of All India Association of Medical Social Profession, AIAMSWP, and I'm working in AIMS New Delhi as Chief Medical Social Service Officer. Social work profession has immense scope in the challenging and dynamic era. With our innovation, collaboration, and evidence-based program, we can address social issue in a meaningful manner and can develop measurable program for solving our most urgent social problem. This impact is quality of life for every individual and human development of the whole. The grand challenge of social work is a large scale of initiative to bring focus and synergy between social work research, practice, and education to bear on the range of universal social, economical, political, environment, and psychological problems. With the right intervention and right time, we can ensure healthy environment for all segments of the society, close the health gap, stop violation in the family and community, eradicate social isolation and vulnerable class, create social response to changing environment, use technology for social development, reduce extreme economic inequality, build social capacity, build financial capacity of the client, medical social work. Medical social worker have the training and clinical skill to treat the patient with a psychological problem. Yet, in health care setting, medical social workers are expected to perform as clinician, but rather as a function who carrying out a variety of tasks and have no relationship with clinical care. The clinical role of medical social worker is eroded, leading the profession is stagnation. Due to due to some confusion over that social worker are expected to do the subordinate role of social work within the healthcare delivery system and lack of treatment modality, especially unique of the social work profession. Upgradation of role of social upgradation the role of social work and preventing medical social work service a viable, a recognizable clinic and especially attending and challenging tasks. The way we are moving toward the consolidation of our profession in country, I'm sure that we are increased scope of our profession, overcome all the challenge we are facing today. I wish everyone all the best. I'm eager to learn more from expert we have with us today. I hope this webinar will be success. Thank you so much. Thank you, Rajiv. Over to Rajiv. Mr. Rajiv, please.
Thank you, sir. Thank you, sir. Now we proceed for the scientific sessions. I am handed over the webinar to the Mr. Jitesh Pandey, who is the moderator of today's webinar. Mr. Jitesh, over to you. Jitesh, unmute yourself.
So thank you. Thanks a lot, Raju sir. Thanks a lot, Sekhar sir. A warm good morning to all of you. So I think there is some issue, so I'm not able to share my screen because somehow some people are presenting their own screen. So I request to all of you, please stop your screen in terms of presentation so that we can share our slides. Thank you. So good evening to all of you. On the behalf of Central Zone of All India Association of Medical Social Work Professionals, so we are inviting all of you, we welcome all of you on the webinar series program 4 titled The Scope and Challenges of Social Work Profession. So first of all, let's understand, let's have a small brief about the day flow, about the today's day flow. So after that, we start our session by the presentation of our eminent speakers, and then we have a presentation of our panelists. And after that, the floor is open for live question and answer session, and then the thanking note by our convener. So there is also some general instructions for today's webinar. So I humbly request to all of the participants to kindly follow those instructions. Like all the participants kindly put their mic on mute mode, except our eminent speakers and panelists, those who are going to present, so that we can have a easy flow of the session. Secondly, we have lots of questions during the session, so it's my kind request to all the participants to kindly keep your queries, suggestions, and thoughts with you. We have a separate time slot. We have a separate session, open floor for live question and answer. So you guys can put your questions on the chat box. So, and we also share these questions to our speakers and panelists. So, and the third one is like at the end of before the end of today's webinar, we posted a link of e-certificate and feedback form. Both are on the same link that is going to be posted on the chat box. So it is my kind request to all the attendees, kindly fill this link on the basis of that, we are going to provide e-certificate to all our attendees. So the link is going to be shared before ending the webinar. So let's start the technical part of the session, and let's allow me to introduce our first eminent speaker, Dr. Anish Kumar sir. So I just want to share some points, some introduction points about Anish Kumar sir. So Dr. Anish completed his MSW from SSUS and did MPhil from Nimhans, Bangalore, and doctoral degree from NG University. Dr. Anish has 21 years of experience, social work practice, research and teaching. He works with Rajagiri College of Social Sciences as assistant professor and former head of the Department of Social Work. He has been an exchange of faculty to University of Utah, USA. He has received several grants for research from different funding organizations such as Australia, India Council, Australia on Health Social Work, German Academic Exchange Program, University Grants Commission, ICSSR, Impress, Government of Kerala, etc., with total grants amounting to 1 crore. So from this note, so we formally welcome to our eminent speaker, Dr. Anish Kumar sir. Yeah. So the floor is over to you, sir. Thank you.
Thank you, Jidesh ji. Thank you for the wonderful introduction. And let me start by presenting my slide. Then we'll start the presentation. At the outset, I would like to thank the organizers for giving me this opportunity to be with you and present my thoughts about the impact of COVID on human life. And I especially thank Dr. B.R. Shekhar for the kind introduction and also for welcoming me, Dr. Giri, the Secretary of All India Association of Medical Social Professionals, the Organizing Secretary of today's webinar, Mr. Rajiv Maikuri, the technical support and organizer of this program, Narendra ji, today's chairperson, Jidesh ji, my co-presenters. And let me present this perspective. You can see on my screen a map of the world with a lot of red lines, red dots. In the history of the world, you have not seen any epidemic or a pandemic which has spread or which has made such a mark on the world map. So we are going through a very significant health issue or a health emergency, which is actually making us to, sorry, I'm just keeping my timing, making us to think about life very differently. Now, let me talk in terms of that. Now, today's statistics, the World Health Organization says, the coronavirus dashboard says now 1,22,37,085 people are affected with the COVID-19. And we have seen many have died out of the problem. And when you look at today's statistics of India, without including today's evening statistics, till yesterday, we have had 7,93,000 people affected with COVID-19 and 21,000 people died because of COVID-19. And we see the scar on the map, which is already there on the screen, can be very well seen. Now, these dots show that where it is more affected. After USA, Brazil, India has the biggest bindi on the map of India. And we have Russia just behind us. So we can see the red marks all across the globe, and it is increasing day by day. Now, looking at the statistics, one side of it shows that several countries were able to flatten the curve, where they were able to control the epidemic to a large extent. And several countries on the right side, red color and yellow color, you could see that they were not able to contain, we are increasing. Compared to many of these countries, our graph is somewhere in the middle, where it is on a yellow line, not a red line, with 3.2% increase in the number of cases. But that is big for a country like India, because we are a large population which can have the larger impact of this particular virus, and it can affect our economy as well as our whole life in the world. Now, you see majority of the infections, 80.9% infections are mild, but even the small percentage can have a greater death toll because it is large in number for a country like India. When you look at the statistics of how men and women are affected, this is actually a data from UK and Italy, not India, but generally this is a trend. Men are more affected than women, maybe because of several reasons. So we have to explore that further. Looking at this graph, you can see that especially those with existing conditions like cardiovascular diseases are at a greater risk of contracting COVID-19 and dying because of COVID-19. And you can be happy, only 1% of people who have no illness dies because of COVID-19. But still, everyone is at risk. So people at risk, it is not as risky like many other diseases, but still, it can be risky because the number of people affected because that is very huge. Now, looking at the virulence and the infectivity of the disease, COVID-19 is not a big problem, but in terms of the infectivity, it is huge. It can infect large number of people, but people die out of this particular problem is less. But you can see the other graph, which shows that tuberculosis is the topmost killer as of 7th July every day. But corona is just behind that. So corona may overtake the tuberculosis. So all throughout the history of the world, corona has become one of the illnesses which is killing more people than any other disease in few days. Now only tuberculosis in front of that. Now looking at this newspaper reports, one report says Massachusetts Institute of Technology did a study which says India may see 2.87 lakh COVID-19 cases by winter 2021. That is next year, February 2021. But this particular study has been questioned because of its methodology, the American study, the American literature. But the Massachusetts Institute has a prediction based on the number of testing and the number of cases which is emerging. And they say if there is no vaccine identified for this, India can become the capital of COVID-19 with a large number of cases every day. 2.87 lakh people having illness every day in 2021. But India has questioned, ICMR has questioned, Union Health Ministry has questioned, because the methodology has not considered what the virus will do, or what our communities will do, and what our government will do. We cannot do anything with the virus because virus will do its own way, but we can do many things with the community. We can do many things with the government. So social workers have a very, very significant role in COVID-19 because these two aspects, community and government. If these two people are not able to do anything, then this can happen. The other context of 2021 can happen. But if the community is going to take care of the situation and the government is proactive, as they are, proactive with regard to the containment of this particular illness, then definitely there is a possibility. So we can do policy researches. We can do research which bring information about social work interventions or interventions of government. That is task of a social worker. And we can involve with the community to contain this disease to a large extent. There's a small video here. Hope you can see. Dideshji, can you see it? Dideshji?
Yes, Dr. Anis, we are able to see the video, but the voice is not there.
Yeah, it's just music, no problem, because definitely technology happens. But video you can see that's best. And the messages are there. It talks about inequalities, talks about everyone is being affected. Not just one person, everyone in the world is being affected because the schools are closed. We're not identified a cure. People's social life has been affected. Physical distancing, education is being affected. Healthcare is affected. The only way is research, analysis, all those things need to be done. This is a document from the UN. The video is from the UN. Our responses can make the difference. So now we have a life before and after COVID. We were just few months back, we were talking about life before and after COVID. Now WHO has told, no, this is going to stay. So we are going to live with Corona or COVID-19. So how do we do with that? That's the important thing. So we are living in a world of, it's called a VUCA world, volatile, highly volatile, uncertain, complex, ambiguous world. So we have come to a new normal. So I want to present my perspective on 4 dimensions. One is about a lifespan perspective of impact of COVID on human life, health and well-being aspect, psychosocial perspective, and the last part is social work practice perspective, which I will not speak, that Dr. Tushti will speak about it. So let me talk about the first thing. You know that across the lifespan, there are a lot of studies. In the last 3 or 4 months, you have seen a numerous number of research articles published in various journals, which clearly indicates that every population in the world is being affected. Children are affected, youth are affected, adults are affected, women are affected, older persons are affected. You can see some of the points I've written. Multiple vulnerability for children, out of class, online classes, mental health issues, physical inactivity, or abuse cases. A lot of things happen to children, youth, physical inactivity, employment situations, social isolation, mental health issues, adults, livelihood issues, employment issues, mobility issues, altogether mental health again. And women, work-life balancing. They work from home, they have to balance work and family life. Difficult. Domestic violence is on an increase. Mental health is a problem. Loneliness, health needs, mental health needs of older persons are also very important. So it has affected every population in the world. Every client, every lifespan, every person's lifespan is being affected. Now we're looking at the health and well-being of these aspects. You can see this is the statistics on the graph. You can see that health critical care beds available in selected countries. You see United States, which has around 35 beds per 1 lakh population, and for India, it is less than 3. So imagine United States were not able to contain this problem. They were not able to give treatment to everyone. Italy is another country which has more than 10, around 12 beds per 1 lakh population, was not able to take care of everyone. They were giving only to people who are young, who are healthy. They were discarding people who are older. So you are seeing such an incident in the healthcare system. Now imagine if the spread goes up in India, what will happen to our country? Because our critical care beds are limited. Fortunately, many illnesses are not very serious. Now, these are issues: containment, surveillance, testing, tracking, treatment. All are issues with regard to health. But diagnosis is important. That is, testing is very important. Quarantining is a problem. Treatment is an issue. Now, there is a large burden of the healthcare system. And also, there is overload of healthcare personnel. Many of my colleagues who are sitting in the audience, who are health professionals, who work with various people of COVID-19, they have overloading or burden of the problem, and they have risk of infection. That's another major thing. Then many times this is a situation where when you focus too much on COVID, we forget about many other major illnesses which are important to be dealt with. Now, see psychosocial perspectives. I see illness, quarantine, stigma. Now we don't go to people who are illness. There's no need to go to them, but we ostracize them. We keep them away from the social context, and we are stigmatic towards families who are coming from abroad, people who are traveling from other places. I am almost reaching my time, so I'll just finish fast. Livelihood and employment is affected. Social isolation, physical distancing versus social distancing. Now we know leisure and physical activities being affected. Pre-existing health and mental health conditions are not treated well. So all these are having an overarching impact on mental health of people. So there is a large point of we need to look for a ray of hope. Where do we find the ray of hope? It is social work. Social workers can do a lot of things. The needs and demands raised by the context of COVID-19 has to be dealt by the challenges and scope for social work practice. So it's a problem. We have lot to do. We have lot to do. In that practice, we have lot of things to do. But the question is, are we taking up the challenge? Are we really taking up the challenge? Dr. Shekhar sir already mentioned, are we really getting into our task? Are we really doing our role clearly? Are we prepared? That's the next question. And the third question is, are we taking action? So I call upon to all the participants of this national webinar that who are a social worker, please be prepared. Let us take up this challenge. We can do a lot of things. I told you the two aspects, the community and government. We can do research. We can get help with the community. We can help with people who are in treatment. You can deal with their psychosocial issues. Everyone is affected. So irrespective of age group, everyone is being affected. So we need to look at that. Now my time is over. Over to Dr. Pushti for making her presentation on the scope and challenges of social work in the context of COVID-19. Thank you.
Thank you, Dr. Anis. Thank you for sharing this insights on your topic like COVID-19 and its impact on human life. It's really a holistic perspective that you are going to share with us. So, before taking so much of time, I would just like to introduce Dr. Tusti Bhardwaj, Assistant Professor, Department of Social Work, Dr. Bhimrao Ambedkar College, University of Delhi. Dr. Tusti Bhardwaj holds BA, MA, MPhil and PhD degree in social work from University of Delhi. She received a specialized palliative care education, MSc palliative care from King's College, London. She conducted her academic research on psychosocial aspects of cancer care, focusing mainly on quality of life and caregiving burden on families. With teaching experience of almost 17 years with the University of Delhi, she authored many research papers in national and international reviewed journals and a book titled Living with Breast Cancer Dynamic Challenges. She has developed a caregiving burden assessment scale for family caregivers of cancer patients in Indian setting, which is published by Indian leading publisher of psychometric tools. A present international collaboration with C3 Founders Institute London for translation and adaptation of palliative care outcome scale for Indian population. She is currently supervising PhD scholars in the area of healthcare. A very recent publication focused on health and human rights, published in one of the Springer journal, namely Journal of Human Rights and Social Work. So, may I request Tusti ma'am, so please start with your presentation. The floor is yours.
Thank you so much, Jitesh, for these wonderful words about me. And I thank the organizers for giving me this opportunity and all the audience for being over here with me to listen to me. To begin with, I would like to convey my thanks to Dr. Anish, who has set a strong background for me. And I'm because he has already spoken about COVID-19 pandemic with all these statistics. I'm taking up from where he has left. So I will be taking up about the social work challenges. Rajiv, are you putting up the screen share or should I do that?
It is up to you, Tusti ma'am. It is up to you. If you're comfortable to yourself as a presenter, then we are okay. Otherwise, Jitesh, you do on behalf of ma'am. Or I share.
I'm just putting up these slides for everyone to see. Just a minute.
Jitesh?
Yes.
I hope it is visible now.
No, sir. No, ma'am. No, ma'am. It is not. Yeah, it's visible. Yeah, it's visible.
Now,
yeah,
now it is visible. It is come up. It is visible.
So the challenges I'm speaking into two dimensions, because for social professions versus human service profession, we need to be very much accommodating about the people with whom we are working. So the challenges for our profession, I am delineating into two major groups, one to the target group and second to the professional. So I will be first speaking about the professionals. I will be first speaking about the target group. So the main challenges which are faced by our target group is number one, the accessibility to the hospitals is restricted. So we all know that the patients who are in serious condition, it was a tough time for them to visit the hospitals, because one, they have a disease for which they might be looking for the health services, and second, they also run the risk of getting into this pandemic situation. So it became a tough task for them to get accessibility into the hospitals. Second, it gave emotional burden, increased emotional burden to the entire family. One, because of their existing health condition. Second, because of the COVID-19 situation itself and getting infected. So the crisis was to the entire family, and the families are really unprepared for it, because we never knew this situation which has emerged today. I hope none of us might have ever experienced it. We might have heard it, we might have read it in history, but this has happened for the first time, so it is just unprepared for all of us. And one of the people, one of the group which are worst affected during this crisis is elderly, and especially those who are living alone, and out-of-station patients who are worst affected because they could not travel to the hospitals for the services. So whatever today I'm speaking about in this, the challenges which are into the health field, because we are hosting this to the medical forum. So there may be challenges in other aspects of our life, but I'm focusing only on the health professionals and their target group. So now talking about the challenges which are faced by the professionals, I have divided them into those professionals who are into the educational institutions and preparing the social work future generation, and then I will be talking about those people who are actually into the field today and practicing day and out the people directly over there. So since educational institutions are closed, so physical classes are not possible, and we have switched into the online education mode. And this online education mode is good enough for theory classes, but if we say for fieldwork practices is a big question. So that's remain always brainstorming exercise how to take up to the students to the field so that they can have a real life exposure and work with the people. So now I'm continuing my talk about the challenges which the professionals are facing exactly over there in the field. So like they do not have target group details. So we have experienced it even if you want to work from home, but none of us might have been having those details of the target group to which we can continue follow up, because the past precedences were not everything into the soap. We were working into the hard copy and the files. So these situations give us a learning lesson that what we need to do futures. I will be talking about this in a couple of minutes. The emergencies which are arise due to such situations, we as a social work professionals are yet not prepared to handle the emergencies and the situations which are last moment of life. We are yet not faced with. We are not teaching our students how to face up, how to deal with the people who are at the end of life, and how to handle the issues of death. These are not yet taught into the curriculum at length. If they are there, they are at the introductory level, and they are into the theory mode. Like our students are not getting the actual physical, actual practical exposure how to deal with those. The issues of last right, especially for those patients who are unattended and especially who are dying out of COVID-19. It was a big health risk for other people who are involved into the last ritual. But this is something which we have never understood as in the theory part or over in the practical part. The bereavement care and the counseling, grief counseling, these are part of palliative care which have yet not been integrated into the main themes, main curriculum. So these are few components which I am highlighting, and all of these make our teamwork very difficult because we have heavy workload on those professionals, especially nursing professionals and the medical professionals who are into the mainstream to work with us. So now I am delineating certain challenges, certain scope which are coming up to our profession, which we need to take up in the future. So talking about the intervention and modalities, the way we need to work, we need to take up a new version of awareness campaign. See, before this, we used to take up the physical level of awareness campaign. We need to go to the community door-to-door awareness service. But gone are the days. I don't think that in coming couple of months or maybe years, this is going to happen. We need to prepare the educational materials which need to be posted up on social media. And there may be people who may question, are the people for whom we are raising these awareness campaigns, are they connected to social media? My answer will be yes. These days, everyone have a smartphone. So even someone who is a daily baser, they have a smartphone. The only thing is they may not be prepared to deal with the social media on that smartphone. So I will be proposing a next line of intervention, how to prepare our target group to reach, to connect to us in my next slide. We need to prepare our self-recorded video sessions on health education so that we can post it on social media. So these are things for which we need not to be in direct contact then and there in the community, but still we can be in contact with thousands of people being in our home. Another thing that I'm proposing is mobile app intervention. This is much evidence in Western countries, but in our country, still not to that extent applicable in the practice level. if we connect the people who are living at like outstations people who need to travel to the hospitals just for getting the medicines or the follow-up, why can't we connect them to mobile app interventions? We can deliver their medicines then and there in the situation where these people are living through district health social through district health social workers. Just like in the teams we have district child care protection officers, why can't we have district health social workers who can connect to each and every person, especially the elderly and those people who are living alone, and they can provide the home care services. There are many people during this pandemic situation who have shared their experience that it was only for the medicines they have to send someone to the dispensaries because they were not in a position to go for themselves. So, and it took a lot of time. So, why can't we avoid such situation? These people can be connected to district healthcare social workers who can look after their needs. I will then go for educational curriculum. We need to integrate these mandatory practical training on especially on handling emergencies, treatment care, and grief counseling to come up for giving the practical and first-hand experience to our students. Now I'm talking about the future learning lessons, how we need to change ourselves. I will say that we need to keep all the reports in soft copy. We need to do away with the hard copy format because if every report with us would have been available in the source, we would have not lost even a single patient for the follow-up. So since it was not available at every place, maybe available in the central hospitals, but at every place, at every dispensary, it was not available. With the social care professionals, it was not available. So that is why it becomes difficult part for the follow-up and remote setting of using of these details can be made available to all the healthcare professionals using passwords so that data can also be protected and we also respect the data of the people. And I will say second, I will say that mandatory e-training center in all the institutions, whether it is a dispensary, whether it is a hospital, whether it is a training institutions, we need to have a mandatory e-training center, even if it's a small level NGO who are working with adolescents in the field of health or women in the field of health. We need to train them how to use our electronic method because all of them are equipped with smartphones. If not all, most of them are equipped with smartphones. Is we focus on VTC. We focus on computer training. We must go a step ahead to focus on e-training. So next, I will please. I have already covered mobile intervention, so no, I'm not wasting my time over here. I will go to the next table for report submissions. For the teaching institutions, we take it up in the hard copy. I will propose these times that go away. Now we need to have a software like Moodle and the Google Classroom, and same thing we can do with the patient report as well. The last, I will propose all these things can be possible only if we all get united. If we have a social work council, we can pressurize our government to give us all those resources which we want, so that we are not shortage of all these resources, and we do not look forward to others to help us to reach to our target population. Thank you everyone for listening to me, and over to the organizers.
Thank you. Thanks a lot, man, for sharing this PPT and this information with us. I think it's a very live information that you are going to share, and it's very insightful for all of us and for all the social work professionals. So, now we are going to move towards our panelist presentation. So we have 3 panelists. So first of all, I'd like to
Yeah. I'm sorry, I'm in the mid disturbing you, but please announce again 2 things regarding our Google form, which is we use for the certificate for the attendees, because many people are joining now YouTube now, new members, and regarding the question answers from the eminent speakers and the panelists. The 2 things before we start the panel discussion. Thank you.
Thank you, Rajiv sir. So for reminding this. So for e-certificate and feedback form, there is a one common link we are going to share in the chat box. So I request all the participants after this panelist discussion, please find some time to fill this form so that we can, on the behalf of that, we can provide e-certificate to all the attendees. So this is the one information. And also for the open live question and answer session, it is kind request to all of you, kindly put your questions on the chat box so that we can combine these questions and share with our panelists and panelists or speakers will respond on this. So thank you, Rajiv sir. So I think we should move forward to toward the panelist presentation. So I would like to invite Mr. Abhishek Rajput, sir. He is a medical social service officer, AIMS, New Delhi. Sir is going to cover the topic on challenges of social work in hospital setting during COVID-19 pandemic. So I like to, Mr. Abhishek ji, please go forward with your presentation. Mr. Abhishek ji. Mr. Abhishek Rajput.
Yes. I'm audible?
Yeah, you are audible. Please.
Oh. So first of all, good evening, everyone. I'm thankful to President AMA, AIAMSWP, Chief MSSO, Mr. B.R. Shekhar, convener of the webinar, Rajiv Makhuri, sir, and all the organizing committee of the webinar, who gives me the opportunity to share my experience related to the social worker setting during this COVID-19 pandemic. Presently, I'm posted in Department of Emergency Medicine as Medical Social Officer, AIMS New Delhi. I would like to share experience and challenges faced by me during this pandemic. I'm requesting Mr. Jitendra or Rajiv sir, whosoever do for me, to present my presentation, which I already sent to you, sir. Who's going to do this? Rajiv sir, Jitendra ji.
Jitendra, please.
Sir, actually there is some issue from my side. So if it is possible, can you share?
Abhishek, you start your presentation. I try to connect with you. Oh, okay. It is come now.
Not visible, sir.
Then it is come. Don't worry, it is come after when it is open.
Okay. Can I start?
Ritesh?
Yeah, Abhishek ji, you can start. I think the screen is visible now.
No, the only screen is visible.
Screen is visible, but it's only the PPT. Open the PPT, Ritesh.
Okay. Please give me some time.
Okay. Okay, everyone. I'm starting this. It's not visible yet.
Now it's visible?
Yes. Now
Yeah, you can start.
Yes, now it is.
Okay, please move to the next slide. Okay. I'm starting this session with one of the most important and primary work of us. Actually, I would like to state the heading, first of all. Challenges of social work in hospital setting during COVID-19 pandemic. Okay. I'm starting this session with one of the most important and primary work of us, which is rehabilitation of unknown and without attendant patients. During this pandemic, it is very difficult to rehabilitate the patient because of the lockdown and ignorance of the organization related to the rehabilitation because of fear of COVID. Even they also refuse to accept the patient who has been tested negative for COVID 19. The other important part of rehabilitation is to coordinate with other agencies like police, judiciary, etc. And we all know lockdown is happening. The other agencies are busy with their work. And the next point is I would like to mention is fear of infection to ourselves and family or other person who residing with us. It is difficult for them as well to cope up with us because of fear related to infection of COVID-19. The people is afraid of us. We are going to hospital and came back with the infection, and we all know about the news, etc. And the next point is I would like to mention is dealing with rumors and fake news and misinformation is also a big challenge faced by us. No one has correct information, and
Yes, ma'am.
available information is changing
Ma'am,
continuously,
just
and it is very
present now.
difficult to answer the question of the patient and their attendance in such dynamic situation. The next point is I would like to
Ma'am,
mention
you can
is
open your PPT in
role of social
background
worker
and
during the pandemic has
click
not
the
been clearly
present now
outlined.
button.
As
Then
we face this
share your screen window.
unprecedented crisis, our healthcare workers are an essential component
Yes, ma'am.
of adequately responding to the crisis at hand. However, the role of social workers can and must play during this pandemic has not been clearly outlined. We always focus on clinical side and we must feel the ignorance of the psychosocial part. And the next point, I would like to mention one incident which we faced on duty
No,
is
ma'am.
elderly abuse. When one of the patients came to my office and said he has suspected COVID-like symptoms and his family refused to accept him in spite of negative reports, close one left their relatives because of fear of this pandemic. It is really disheartening situation for us. The other important point is the hospital administration is focusing only on the clinical part. Importance of psychosocial part is ignored, which is essential to fight with this pandemic, as we clearly seen the importance of it. People are committing suicide, cases of abuses are increasing, etc. We must focus on environmental issues as well because it affects
Yes, ma'am. Yes, ma'am. Yes.
during this
Please.
kind of
You
pandemic.
can mail, ma'am.
As
Yes, ma'am.
previous eminent speakers said, we feel discrimination. Now I would like to add the point of discrimination of the society, landlords, neighbors.
Yes, ma'am.
They are afraid of us because we are working in health settings. Chances of infection are higher with us, and we have to face it. And we don't have any option because no one has clear idea about it. The other very important point I would like to share as a challenge faced by us in the hospital setting is lack of manpower. No one is prepared for this pandemic. It is imposed on us.
Ma'am,
We
you
face
can
lack of
present now,
manpower.
ma'am.
Some of us are stuck in lockdown. Some of us are infected. And I would like to correlate the next point with it. The workload is increasing. While we are facing the lack of manpower, the workload is gradually increasing. We have to do some other work related to this pandemic, like reporting, locating the resources, looking after the transportation, etc. And work comes to us related to this on daily
Yes,
basis,
yes.
dynamically changing situation. And the dilemma, the next point, important point is I would like to mention is the dilemma. We are facing the queries related to funeral, dead body, etc. People are in panic. They don't know what's going on, what will happen to their relatives. It is very difficult for us to handle the situation tactfully. And we don't have clear idea because in this changing perspective, we don't have exact information what's going on. Is change on daily basis. The next challenge which we can't feel before the pandemic, we feel infrastructure problems like separate office, separate washroom, which we cannot feel before the pandemic. We are in need of it because the main preventive measure to fight with this disease is social distancing. And because the separate arrangements, we cannot follow the social distancing. We have to work together, and the chances of infection are higher. The other important point I would like to mention exposure with attendance. The risk of exposure with the patient's attendance is very crucial for us because we may look after the patient. We also have guidelines for staff, but the attendant is roaming everywhere in the hospital for investigation of the patient, for their personal work, etc. So they might be a career, and we don't have any checks on them. The other point I would like to mention is unawareness in support staff like security guards and some other support staff like Sulabh, etc., who is working in the hospital, etc., is also a challenge for us. They hardly follow social distancing like preventive measures. That is why the ratio of them in positive patients are higher. If it is also a threat for other staff to get infected with them because they are working with us and there is no training program for them to how to maintain social distancing. They gather and they put their attendance in bunch. It's a very difficult for us to work with these kind of situations. I would like to mention the other next point on the lighter note, dependency on metropolitan facilities. Most of us are dependent on public transport as everything is available in easily available in metropolitan city. It is also a challenge for us in this kind of situation when the lockdown is happened. As I can say, we have to focus on personal skills as well, like driving, cooking, etc., which positively makes us self-sufficient and to face these kind of situations in future. Now, moving to the next slide, the time for suggestion for future preparedness. Mr. Dinesh, please do it for me. Yes, I'm previous one. Yes, suggestions for future preparedness. In these, I would like to give 5 or 6 suggestions. One of this is crisis intervention. We all study crisis intervention in social work, but we have to increase focus on crisis intervention. We have to be prepared for this kind of situation in future. We may increase the portion of fieldwork and syllabus related to crisis intervention. Nowadays, we just read it as a topic, and it's very, as I can say, as a student when I was studying in MSW, the crisis intervention is a small topic, just covered theoretically. We don't have any opportunity in study tour, in field work, or whenever the crisis to be happened in India to visit the place and help in that. The other point is social determinants of health. I would like to mention a report published in Social Work Today about this. Hello. I'm audible?
Yeah, so Mr. Abhishek, only 1 minute more left. So
Okay.
Thank
you. Research suggests only 10 to 15% of health outcomes, such as mortality, are influenced by medical care. The remainder is predicted by environmental factors such as access to income, education, food, and housing. These environmental factors are sometimes referred to as the social determinants of health, and healthcare system has been rapidly trying to address them to improve population health. SDOH are particularly important to consider during a public health crisis because it means that already vulnerable populations are at higher risk of being adversely infected. The next point is safe working environment. Safe working environment in essential healthcare is also a very important point I would like to share. And the next one is social worker can also a vital role in advocating for local, state, and policy changes so that we can emphasis on environmental issues in our policy. And the next one is definitely we have to set our long-term goal, health for all. We definitely set our long-term goal as health for all to face this kind of situation without fear. And last point is incorporation of social worker at all level of healthcare response. I would like to explain this point with example of our hospital. We are responsibility to execute the process of Rashtriya Arogya Nidhi through social worker. As per data of Ministry of Health and Family Welfare, 90% and above cases all over the India came from AIMS only. The main reason behind this is a social worker. In the other hospital, this scheme is executed through administration, and it is very difficult for the and patient and the administration to coordinate with them, with each other. So I would like to conclude my words with social worker will be vital during the recovery process. When the immediate threat of COVID-19 has passed, not only can social worker help us as individuals try to rebuild connect social connections and adapt to life after the outbreak, but they can also support political and healthcare systems better prepare for future public health crises by ensuring that people have access to basic needs such as income, food, housing, and healthcare. It's been a pleasure with all of you today. Thank you. Next to you, Jitesh.
Thank you, Mr. Abhishek. Thanks for your sharing and your presentation. I think you just share your handful experience in the hospital setting, and it's really insightful for all of us. So, so I request two other panelists to please kindly follow the timeline because we have a very certain timeline to present. So, on this note, I'd like to invite our next presenter, Mr. Jamil Ahmed. So, Mr. Jamil Ahmed is a social work student. He's pursuing MA in social work from Department of Social Work, University of Delhi. So he's going to present, he's going to sharing his observation regarding the social work career path pre and post COVID-19 scenario. So I would like to invite Mr. Jamil Ahmed, please proceed with your presentation. And kindly follow the timeline. The timeline for panelists for presentation is 8 minutes. So please follow the time. Thank you, Mr. Jamil. Over to you. Mr. Jamil?
I guess his connections were dropped.
So, Jitesh, we continue with Mr. Rahul.
Okay, sure. So we have another panelist. I think Rahul. So I'd like to introduce Mr. Rahul. So Mr. Rahul Mahida. He is a social worker, counselor, trainer, and academician. He is from Baroda, Gujarat. So he's going to cover the topic like remedy to coping up the situation of COVID-19 as a professional social worker. So I'd like to invite Mr. Rahul. Kindly go with your presentation, Mr. Rahul.
Thank you so much, Jitesh. Hello and good evening, everyone. Am I audible and visible?
Yeah, perfectly fine. Yeah.
Okay.
Please go ahead.
Jitesh, please proceed with my presentation if you can. Okay. So before I start, let me just give a brief about what the topic is all about. I don't want to make any generalization about the remedies towards coping with this COVID scenario, but this is purely on the basis of what I have experienced and what I have realized while dealing with this pandemic and throughout this 3 months or 4 months of lockdown scenario. So uh, let's go with the presentation first.
Jitesh, any issue? Jitesh?
Can we move to the next slide? It is just sure. Yeah. So good evening, everyone. Before I start with this, my topic for this webinar, uh, I would like to quote the statement given by Solomon Matson says that unless we expedite action to respond to the world's major challenges, our profession could continue to be called to question, first by critics, citizens, and then our client system, and ultimately ourselves. So as we all know that the COVID-19 pandemic outbreak has significantly affected every citizen in the world. It has given rise to the chaotic and traumatic situation due to financial losses, job insecurities, social distancing is the new normal nowadays, psychological stress and depression leading to severe economic and social crisis. Every one of us been affected and experienced this situation. In this scenario, moving to next slide, the even the efficiency of social worker in dealing with such crises as well as the credibility of professional social work discipline in India is also in question. The question slide, I think already by Dr. Anish and Pushti ma'am has covered certain points by the effect of COVID-19 on human life, has questioned the same question to the professional social workers. Whether the social workers are trained enough to deal with such global crisis or disaster, the question about preparedness, the competency about the social workers. Whether the social worker are trained enough to provide effective intervention in such situation, the attitude towards serving to mankind. We know that the principles and the values and ethics we have learned in the school of social work about being non-judgmental. A very good example shared by just now by Rajput sir, saying the elderly been discriminated by their own family member. The health workers are being discriminated. So this is what the question is about, the serving to mankind. And the last part is whether the social worker are even prepared enough to cope with this pandemic. Here the question is about their own coping mechanism by their own individual identity. So the expert in this forum has already shared the Indian dialogue about the same. If you are into professional social work, I'm asking this question or I'm pointing to the audience, the students and all the other practitioners on this forum, that if you are into a professional social work, just ask the opposite question to yourself and just introspect. And again, noting that just introspect, because this is the basic element I had applied to come out of this situation, introspection. Moving to the second phase of my topic, I would like to quote my own story, and that will be correlated with the very dramatic demonstrative story of Lord Shiva, a farmer, and Indra. So let me give you a short brief about what I've been gone through this lockdown. So it was month of December of 2019. I have decided to switch to a core social work once again. I've been into academia for 4 years, served as an assistant professor for one of the private university in Baroda itself, and also in the practice of counseling and consultancy for CSR and other works from last 5 years. Before that, I was in industry. So now this is the time I have realized that I want to switch to a core social work. So basically, I want to join an NGO organization or the government service. So luckily, I got an opportunity in the month of January. I joined one organization, very renowned one in the local jurisprudence. It took just only 1 month. Hello, am I audible now?
Yeah, you are audible.
Yeah, it took only 1 month to make me realize that this is not my cup of tea. Because with the vision, I want to join that organization. They've been offered to me. When I match with this, the actual work platform, I realized the organizational and my individual goals are not being met. So I realized that let me put my papers without wasting time and start to discover new arena. So before even putting the paper, I had just word with my senior management people that I'm thinking about it. So I want to give time to myself, and if something happens, then I will definitely see. In the ending of March, the very first episode of nationwide lockdown presented, and during the same time, the company offered us to stay at home and work for a while. Recent, after 15 days, I have received one email saying that the company is offering now layoff to the organization because of funding is lacking, because of the project being severely affected, and I've been compelled to sit at being at the managerial position. I had a team of 15 to 20 people under me to look after. So being into adulthood, being one of the great owner of your family, young also, and so enthusiastically working on the field of social work, you can understand how it can affect your morale, how it can affect your self-confidence, how it can affect your mental health as well. Your other or psychosocial environment affected brutally or severely. So it took 3 months, and it was the hardest time of my life. So how I help myself to come out of this situation and cope with the situation, I would like to portray with the same story. Can we go to the next slide, sir? The next one, the picture of Mahadeva must be there. No, the previous one. The picture of Mahadeva, yeah. So this is the story about training after 12 years. So once, I think many of you must have heard, but let me just, because I want to correlate with this thing. Once Lord Indra got upset with farmers and he announced there will be no rain for upcoming 12 years and you won't be able to produce any crops. So farmers begged for clemency from Lord Indra, who then said rain will be possible only if Lord Shiva plays his damru, but he secretly requested Lord Shiva not to agree with farmers. When farmers reached to Lord Shiva, he repeated the same thing, that he will play damru only after 12 years. Disappointed farmers decided to wait till 12 years, but one out of them regularly was digging, gritting, and putting manure in the soil, sowing the seeds, even with no crop emerging. On the other hand, the other farmers were making fun of him, that how foolish he is, what he is doing, knowing that the rain will come after 12 years. So after 12 years, the rain will come. When other farmers were making fun of him, after 3 years, the farmers asked to that one farmer, why are you wasting your time and energy when you know that the rain will not come? He replied gently that, I know the crop won't come, but I'm doing it as a matter of practice. After 12 years, I may forget the process of growing crops and working in the field. So I must keep it doing so that I'm fit to produce the crop. The moment there is a rain after 12 years, I will get my fruits. So hearing his argument, Goddess Power praised his version before Lord Shiva and said, you may also lose the practice of playing the damru after 12 years. So the innocent Lord Shiva, in his anxiety, just tried to play the damru if he could. And hearing the sound of damru, immediately there was rain. The farmer who was regularly working in the field got his crop emerged immediately. And the others were disappointed. Debriefing to this story, I would like to portray that it is the practice that keeps on making you perfect. We become even diseased or old just because we want practice. The practice is the essence of quality survival. So let the lockdown be lifted after 2 weeks, 2 months, or 2 years. Whatever profession we are in, we should keep sharpening our skill, practice with what we have, upgrade our knowledge, our skills. Don't wait for rain. Upskill yourself so that you are ready to meet the challenges in coming future. Let us not waste our time like how the farmer did, but our time productively to improve our skills. Hello? Yeah. So this is all about the story. Yeah. So this is all about the story of patience, faith, perseverance, and practice. This is the key I have identified during this pandemic of 3 month lockdown. Uh, so correlating my own self to the same story of this farmer, I have realized that going back to your roots, identifying your untapped or maybe already known skills, the Johari window we've been taught in the school, we need to apply those all set of knowledge and skill during this pandemic. You need to expand your horizon of all the skill set knowledge and find out the way, all the possible ways. So here are the certain suggestion or my concluding remark towards my presentation that patience, faith, and perseverance, how you can come to that point about that revisiting and reinventing the skills methods of social work to cope with the pandemic scenario. In this regard, social worker could assume the role of educator, the counselor, the referral, taking care users to caregivers. Our counseling intervention should draw on resiliency and relationship building strategy, as well as strengthen-based practice combined with a blend of spirituality, since many families and individuals, especially older adults, find comfort from this dimension. Also about the application of indic value of social work. As we know that the social work is derived concept and derived discipline from Western. Now this is the high time when we correlate our indic value to social work platform. So all the social work indic value like Satya, Nishtha, Upeksha, Ahimsa, this even the practice of yoga, vipassana, meditation, naturopathy, hydropathy, uh, Ayurveda assume greater significance in social work curriculum as it can help the client to overcome depression, stress occurring due to such COVID-19 global epidemic. Despite yoga being acclaimed worldwide as effective therapeutic tool to treat various psychological disorders, anxiety, stress, depression, even addiction as well, unfortunately, it is not been included in social work curriculum in many Indian universities. I think the same point being highlighted by Pusti ma'am in her presentation. That the inclusion of certain points in the curriculum to get the youth or to get our upcoming social work generation prepared for such pandemic. So to conclude my presentation, I would like to quote a statement given by the Secretary and General of IFSW, Dr. Rory Duell, says that social worker at every level have the skills and capacity to not only address safety for today, but to translate fear, grief, loss into empowerment and social transformation. So I would like to conclude my presentation here with the simple example of Ramayana. You have to be Jamwan, the bear, to your own Hanumana self. The way Jamwan made Hanumana realize about his own hidden skills and talent. This is the time you need to introspect within and identify all the hidden talent, all the skills you have learned, all the knowledge you have learned, or apply it in the field. Thank you so much for having me here. Thank you so much. Over to you, Rajiv sir, Jitesh ji.
Thank you so much, Rahul. Thank you so much, Rahul, for your presentation. And it's really insightful. Your amazing story is like we are able to connect it with your story. So it's like Ramayana story, Shiva story. It's all about a very challenging kind of thing. So thanks for your sharing. Thanks for your presentation. So I think Jamal is with us. So Jamil, are you here? Are you able to hear? Jamil?
Yes, sir.
So I would like to introduce Mr. Jamil first. So Mr. Jamil is a social worker student, master's MA in social worker student. He was from Department of Social Work, Delhi University. So he's going to share his observation on the career path of social work pre and post COVID-19. So over to you, Jamil. I think there is some network issue from your side. We are not able to. We're not able to hear you.
Yes, sir. There was. Now it's fine. It's fine now. It's fine now.
So please start your presentation.
Can you show me slides, sir? Yes.
Yeah. Give me a second. I will show you slide. With your introductory note. Yeah. Jamil, are you able to see the presentation
Yes,
on the
sir.
screen?
No, sir.
Able to
Will
see
not.
the presentation? Okay. There is some issue. Right. Give me a second. Yeah, Jamil, please start. The presentation is on the screen,
Yes,
Jamil. Please.
Hello, everyone. Yes, sir. Thank you, sir. Hello, everyone. I'm MD Jamil Ahmed from Delhi School of Social Work, pursuing my MA in Social Work. Final year student. I'm final year student there. I will be talking about the student's view on social work, how social work trainees are facing or what are their career perspectives. I would like to start with a concise story, very common story, that is thirsty crow. There was a crow and he was very thirsty, and he was searching for water, but he could not find one. He could not find water around. But suddenly he saw a pot and water pot, and he flew down, straight flew down, and he saw some water in it, but he was not able to drink that water uh, because it was very low in amount. Then he got an idea that I will be picking, and there was some stones or pebbles around near the pots, and he got an idea that he started picking the pebbles and drops and dropping into the pot. But and water level started rising. After some times, he succeeded. But now there is a change in the story. The change in the story is that uh, a stone hit the pot vase from the outside, and water started coming out of pot, and that is the current pandemic, and that is COVID-19. When I joined the department, it was not pleasant, but it was something. I had some dreams, passion. I had intention toward this profession, and I joined at the first day. Our HOD ma'am, Dr. Niragri Mitra, told that you have chosen this field, and you have to go through a rigorous training. You have to work in undesirable conditions. Then I was shocked that what is this? Because I was only have intention that I would like to help people in need,
and there was no how I will help them. No way how can I reach to them. But when I started work, I started going attending classes, and I started going to fields, and within a month I got a good hello. Within a month I got my intention clear that I will pursue this career. I will do this social work. Um, and it started smoothly. It started, and it uh, went very well for 1 year approximately. And in this now in this time, the in the month of March, the pandemic broke out, and we started facing some problems. We are out of field works, and we are out of field works. We are not able to work on fields. But the thing is that uh, what are the challenges to this now we are facing as a student of social work? Um, First thing is that the concern was first that this pandemic will go on within some time, but it went for long, and it is still going, and there is uncertainty. There is no uh, uh, ray of hope that uh, we can work on that. There is no currently there is very uncertainty in careers, because our departments, our fieldwork directors sent an email to us that we are receiving regret notice from the organizations who are already placed in the placements. But now the thing is that we are getting regret notice from them, and even we as a as a social work internship program in the second year first in a block placement program, we were facing the problems in getting internship, which is unpaid. And if we are facing the problems that which is unpaid in nature, and we were not getting that, and still we are facing. And but and then how will we convert to that into a full-time job, uh, which is we are going to ahead, we are going to uh, sit for that, for an interview program, for interview. Now the thing is that we are facing some problems, like we are out of field work, like lectures, workshops, supervisions are lacking in supervisions, uncertainty in future, uncertain futures, recruitment placement issues, facing psychosocial problems also, kind of like there is a career issue. We are facing that what will happen in future to us, because we have a diverse classroom of
Tamil, sorry for interrupting. Two
yes
more
sir.
minutes left. 2 more minutes left, please.
Okay sir. We have a very diverse classroom of different disciplines, of different space stream, and some are dropouts for 2 years, some are dropouts of 3 years, 4 years, some have left job, and now we are in a state that we will hardly will get a job in this in this pandemic. These are the some issues that are we as a student of social work facing currently, and we need to work out on this. But I have a solution to this, that as a social work profession, it is a practice based profession, and we as a social worker, we can work on that. And from the conception to the death, we are in need. We are in need from the conception of human being, of human to the death. So we need to identify the intervention areas. We need to identify different. We need to acquire different skills. We need to jump to other fields also, where we can work on that. And we have to find out new career paths and in the social work, other than uh, like core social work, other than core social work interventions. And this is the thing. So I would like to, hello sir, can you show
Yeah,
my
yeah,
first
yeah.
slide?
Yeah, okay. This is what slide. This one. Jamil, this
No,
one is
the
your
first one.
first slide. This one, introductory slide.
No, sir. Yes, sir. I would like to end my talk with this quote by Franklin D. Roosevelt. In this time of difficulty, we must and shall choose the path of social justice, the path of faith, the path of hope, and the path of love towards our fellow men. Thank you.
Thank you, Jamal. Thank you, Jamal, for sharing your presentation. I think you incorporate each and every minute details of your observation, of anecdotes from your stories. So it's really insightful. So I'd really like to thank each and every panelist first for their presentations. And now we are going to open the floor for questions and answer session. So any of the participants want to share any thought, want to ask any questions with our speaker, with our relevant speakers, they can post their questions on the chat box. In the meanwhile, me and Rajiv sir collating the questions and sharing with the speaker. So the floor is open for all of the attendee participants. Kindly put your questions, your suggestions, your thoughts on the chat box. In the meanwhile, I'm also going to share the screen, the link for feedback form and like e-certificate link. Both the links are same, so you can also fill that link and give the feedback. Yeah, thank you. The link is shared on the chat box. So I request all the participants kindly follow the link. This is the same link for feedback and for the e-certificate registration. So I request all the participants kindly mark some time to fill this form. So there is one question from our participant, from our attendees, Ms. Akriti Tripathi. So the question is, what can be possible role for NGOs and social work professionals in the pandemic for social services with no and minimum funding? So thank you for your questions. I would urge to Mr. Anisher or Tusti ma'am to please answer this question, or please go with that question. Yeah.
Right?
Yeah, Tusti ma'am.
I'd like to respond to this in a way like even during this pandemic, there were various individuals, philanthropists, who come together and develop an informal group to help people to handle to this crisis situation. So it is not so that if you want to serve to the people, only that funding is required for helping us out. NGOs funding has not been stopped even during this pandemic. Funding is coming up. It is a temporary situation. I hope that this temporary situation go away soon. It may take a couple of months more. But if we definitely want to go ahead, continue doing the same which we are doing now. So it's quite possible that the new projects, taking up of the new projects may not be possible in this situation, but continuing with the same work for which funding is already been there. One, that can be done. Second, we can develop our own informal groups and take away, keep up with the service which we are doing as a. Over to you, Jitesh.
Thank you, ma'am. Thank you, ma'am, for responding on this question. So I request Anish sir if you want to add something. Yeah,
Ma'am had clearly mentioned about the possibilities, but I would suggest that from examples from various NGOs and organizations, there have been a lot of things happening on a voluntary basis. Because now you see there's a lot of community mobilization possible in this context. Because I see volunteerism is something which is very well available in community. So as NGOs, organizations can very well bring in voluntary participation of youth or others who are willing to collaborate and contribute to the process, especially in terms of human resources as well as financial. Because I've heard from several organizations, social schools of social work, as well as NGOs, who have been able to raise funds for these people who are in need of service. Because we know that people have lost livelihood, people have lost their jobs, so they have to be supported. In that context, people who are homeless and people who are on the streets, they're all being affected because of this context. So I think fund mobilization through philanthropic means that is one way of doing it. Second thing is basically volunteerism. And third thing is once we demonstrate some good work, funding is available. Because corporates have funding available because of the context. We never thought about this, so we have no projects for COVID. So definitely we have to bring in new projects for COVID only through our demonstrate work. Then probably we'll approach some CSR organization, funding organization. Then definitely we will get fund and resources for that. I think let us demonstrate, use the volunteerism in the community. Let us use the social work students. Now that is another group of people. Now, you know, across the country, the social work students have no possibility of doing their field practical. Now, whether we can mobilize that as a resource to use for the community benefit, that's another major human resource in front of us, because every state has several schools of social work where students are still at home without doing much thing. So when you give an opportunity for such initiatives, there's a lot of models like, for example, Loyola College Chennai have initiated a program in the community for helping people who are affected, who are quarantined and things like that. And they have been recruiting volunteers for that service. In Kerala, Sannatham, that's a scheme of the government of Kerala where they have initiated online registration of volunteers, and they got enough and more people for doing the voluntary work. So I think NGOs should come forward to do that.
Thank you, sir. Thank you, sir, for your kind words. So there is one more question. Yeah, Rajesh, sir, you want to say something? Yeah.
I'm asking because it is also live in the YouTube. There is a one question raised by the Mr. Roy in the YouTube. The question is, which social work fields have more opportunities in post-corona period for a social work student, and what are immediate steps he can take now? It is for the Dr. Anish and Dr. Tushar. Again, please. It is clear, or I repeat the question?
The question is clear. I think there was one study recently done by a colleague of mine. They asked for what type of work social workers do during this COVID-19. And one thing which emerged in the study was that multitasking is the role social workers do. So that's one area where we are experts in, but sometimes we are misused for that also. But that is so. But I think social work responsibilities are all throughout in every field. For example, if you're talking about specializations, you have, if you are a community development specialist, or if you are a mental health or health specialist, if you are a family and child welfare specialist, or you are even if you are in a correctional setting, there is a lot possibility of intervening in any specialty field. But I would see as of now, large level of possibility in the community setting, because a lot of things can be done in the community, because we need to prevent community transmission. So what we can do about it. Or else mental health, another major area. Again, mental health issues are seen in the community, and tip of the iceberg is only found in the hospital. So mental health, community mental health. So every field of social work has relevance. So social work has great relevance in this context where COVID-19 posed it. But the question is, are we able to establish that it is our primary competence to deal with many of these things? If not be duplicating our service for the professionals, rather we should develop our own models and practices, which will help us to develop social work into a better career option, as well as into a profession which is accepted and valuable for the community.
Dr. Anish. Now my question to Dr. Tushti, there is a question from the chat box of the Google Meet. Question by asking by the Manisha Banerjee. Are there any scopes for virtual internship for the social work students in these situations? If so, do virtual internship have the same values as practical internships?
Okay, so to respond to this question, I will say, see, virtual internship, because this situation has happened for the first time, and we all are learning to handle to this situation. So virtual internships are gradually popping up. So just a fortnight before, saw some advertisement to a friend circle wherein people were inviting social work students for giving them exposure for data management and some kind of research work. So these may gradually we may see such opportunities coming up in future as and when the social work institutions are getting open at the new academic session. And responding to the second part of these questions, of course, nothing can replace the field situations experience. The virtual opportunities, the virtual internships can give us a different kind of experience, follow ups, connecting through a lot of technology and doing a lot of surveys and data handling and analysis. Probably the students were not exposed to before because there were a lot of community level work already into their hands. So this virtual internship will not give them that kind of exposure which you will have directly into the setting. But yes, something is better than nothing. If we uh, follow that philosophy, then yes, this kind of opportunities can give up some learning lessons to the students. And we hope forward in the future. We look forward that we get more opportunities for our students.
Hello. Thank you, ma'am. Raju, sir, is there any question on YouTube?
Now, last question. Last questions we take to panelists, Mr. Rahul or Mr. Abhishek, or reply to them. It is from the Pratyusha R. As you all have discussed how this pandemic has become a disruptive towards both illness and economy, I also request to draw some light on the animals who are being abandoned due to the pandemic and how doing so increase the risk of further illness. Rahul, are you interested to reply this? Rahul, I am audible.
Yeah, you are not.
Rahul,
Yes. Basically, I cannot fully attend this because it is not my forte about But I would like to portray one example of animal abandon. Few days back, only like many shelter home here in my city as well. They were taking care of several dogs, cats, and other pets in their in-house farm nearby to my area. And since this COVID has begun, most of their staff been absent from coming to their farm, and they compelled to open their this house. And most of the their pets are on the street road. So like all this upgraded and mixed what we call hybrid dogs and cats we have seen left abandoned on the street area. So this is a kind of severe issue came across to me that I am not having any idea about how to deal with such scenario. So I think any expert person from this forum answer to this query would be a highly remarkable part.
thank you. Thank you, Rahul. I'm taking forward this, but I am also running the time and take last questions, which is for the another panelist, Mr. Rajput. Abhishek, are you there? Abhishek? Abhishek, it is specifically by your name. I would like to ask from the Shailesh Gonkande. I would like to ask the question to Rajput sir. Please explain. Help to all. Help to all. Abhishek?
Okay, sir. I'm audible.
You are audible. Please reply.
Okay. Help
This is the
for
last
all.
question.
I would like to. Okay, sir. I would like to explain the health for all. It's like right to health. Sorry, someone is.
So may I request the other participants please to
Piyush Singh, please.
Okay, that's fine. Health to. I would like to explain health to all is like right to health. Health is accessible to all. Number of doctors increase per 10,000 population. Number of beds are increasing. All in all is health is accessible to all. They don't have to, people don't want to travel for health far away, like 20, 30 kilometers. And actually, health for all means accessibility of health to all, availability of beds, doctors, medicines, and it should be the responsibility of government. The availability of health should be in public forum, because the privatization or marketization of health, it is very bad thing for the in the welfare states and in the democratic country like India. We have to encourage the public health so that the farmers of India, who share the 60% of the 60 to 70% of the population of India, to access the free health. Thank you, sir. I think it's clear to Salish ji.
Thank you. Jitesh, proceed.
Thank you,
Close the-
Abhishek ji. And due to the lack of time, we are not able to take another questions. So hope this is the last question for this question and answer session. So I would like to invite Mr. Raju sir for both of hands. Raju sir, please.
Thank you so much, Jitesh. Thank you so much. This is the last, but I'm just see, because the videos, many people are take the tea between our sessions. Many join our session in the car. Many are started the evening walks. So this is happens in our webinar, which is I observed. Mr. Rajpal Singh Pawar is started in the daylight and now it is the night. He is in walk mood. So thank you, Mr. Pawar. You are still with us during your evening walk. So thank you so much. Thank you so much. Now on the at the end, thanks note. I am started with our Honorable Association Patron Dr. Anil Goswami, respected President and General Secretary, and all participants. It's my privilege to have been asked to propose a vote of thanks. I, on behalf of the All India Association of Medical Social Work Professional governing body, extend a very hearty vote of thanks to the honorable participants who blessed us with their presence and took out valuable time of your busy schedule. I must mention our deep senses of appreciation of Mr. Jitesh for his work. I would like to extend a special thanks to Dr. Narendra for inspiring us. I express my gratitude to our speakers, Dr. Anish and Dr. Tisti, and our panelists, Mr. Abhishek, Mohammed Jamil, and Mr. Rahul, for sharing their experience, knowledge, and thoughts on scope and challenges of social work profession. I hope their experience would be fruitful for the participants. I am very grateful to All India Association of Medical Social Work Profession for giving us opportunity to organize this webinar. Also, no program can become successful with a single person. So I extend my big thanks to Mr. Jitesh Pandey for his support. Thank you guys and girls for making this webinar successful. Thank you so much to all of you. Thank you. Okay, bye. Take care. Good night. Jai Hind, Jai Bharat.
Thanks a lot. Thanks a lot, sir.
Thank you.